This is Radio Health Journal. I'm Nancy Benson. This week, why are preventable heart attacks often not prevented?
Over 75% of people got the question wrong, what causes a heart attack? Most thought that it's just about cholesterol.
Misunderstanding heart attacks when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics, from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
He had asked for a break. He was not given what he needed to stay safe, and he died, unfortunately, on his way home with his son.
Hotter temperatures are worsening conditions for millions of outdoor workers. What's being done? Then,
concrete, for instance, it's the second most highly consumed product on the planet.
Concrete, steel, wood. What makes some building materials better than others? I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Heart disease is America's #1 killer, but the way we look at heart disease keeps us from doing as much about it as we could. Heart disease builds up silently in a person's body over decades and often strikes without warning. It seldom produces an heroic years-long struggle, so we often don't understand the impact.
Imagine 4 jumbo jets crashing every day for a year, killing everyone on board. Somebody would do something about that, right? Well, that's how many people die of heart disease every year, and over 80% of those deaths are preventable. So we wanted to understand where the disconnect was.
Dr. Andrea Clemes is Chief Medical Officer for the national concierge medical firm MDVIP, which sponsored a national survey on exactly that. What misinformation is out there that keeps us from preventing heart attacks?
What we found was that over 75% of people got the question wrong, what causes a heart attack? Most thought that it's just about cholesterol. But in fact, most heart attacks happen in people with a normal cholesterol level. The other piece of that puzzle is inflammation, and that's what people didn't know much about.
When heart attacks strike, we often picture victims clutching their chests and falling dead on the floor. That may lead a lot of people to conclude, when your number's up, there's not much you can do about it.
Over 70% of people in this survey knew that heart disease was the #1 killer. Interestingly, though, more were afraid of getting cancer and dying of cancer than of dying of a heart attack. Over 60% said that they knew the risk factors for heart attacks and they knew their own risk. But 62% of people failed the heart attack IQ survey. So they think they know what they know, but they don't really know enough.
That leads a lot of us to focus on low-fat foods, when fats aren't always the problem. In fact, the MDVIP survey finds that more than half of us believe that people with heart disease should eat as little fat as possible.
All fats aren't bad, and so I think that's the misconception. There are some good fats, and in moderation, things like salmon or nuts or avocados can actually help you prevent a heart attack.
What's more, if we're paying attention only to fats, we're likely to eat way too much sugar. Many food processors add extra sugar to low-fat foods to maintain their taste. And sugar has been shown to promote low-grade chronic inflammation in the body. Clemes says that's the real heart disease villain.
Chronic inflammation can make you more predisposed to build up that plaque in your artery. And, acute inflammation is a good thing. Like when you get a splinter and it gets all red and swollen, it's because your body's fighting the bacteria and the bad things around the splinter and trying to get rid of it. But chronic inflammation, like from smoking, from bad diet, from not exercising, from uncontrolled diabetes, all those things, that chronic inflammation will not only cause the plaque to grow, but it will try and wall off that plaque, just like the splinter, except that it will also irritate that plaque. And if the plaque breaks open, it will form a blood clot, kind of like when you cut yourself shaving. You get that blood clot. Well, that's what will happen in your artery, and that's what clogs the artery and causes the heart attack or the stroke.
Yet most people are totally unaware of that. Unlike some other diseases, Clemmis says heart disease suffers from a surprising lack of awareness. One other surprising fact is the relative lack of attention given heart disease by women. Typically, women are households' health CEO and are more aware of family health than anyone, but not with their own heart disease risk. Clemmis says there are probably several reasons.
Women are protected against heart disease premenopausally, so I think they don't really think about it till later in life when it's probably too late. And also, stereotypically, having a heart attack has been a male disease. And so, especially also since the symptoms of a heart attack are common that we all know about for men, the elephant on your chest, and women may have some atypical symptoms, like being nauseated or just having jaw pain, and they may not run into the doctor as quickly with these symptoms, which is probably why women die from their first heart attack more often than men do.
So what should all of us be doing about inflammation if that's really the bad guy when it comes to heart disease?
Like a lot of the steps we talk about for healthy living, eating healthier, exercising, and I think with exercise, it's something you have to find what you will do, what you like, so you can make it a good habit. Making sure you go to your dentist. I think the most important thing, though, is going to your physician, your primary care physician, and like an MD-VIP physician across the country who will check those inflammatory levels and can understand if your level is elevated and then work with you, whether it's diet and exercise, whether it's fixing your sleep patterns, whether it's decreasing your stress, all of those things, or do you need medication like a statin to decrease your cholesterol or other things to help decrease that inflammation?
However, Clemmis says even though she believes blood tests for inflammation should be routine, you can't expect your primary care doctor to do one without asking for it. Insurance often won't cover it. But she says it can tell you far more about your heart attack risk than many other risks you may imagine.
You can imagine if your level is elevated, if you have bad diet, bad exercise, uncontrolled diabetes, family history, all of those things. You can imagine your level could be elevated, but it may not. It's just like knowing, do you have diabetes or not? You need to check your blood sugar and what your blood sugar level is over a period of time. You need to get a blood test to identify if you have elevated inflammatory levels. And if you take the quiz at mdvip.com/heartattackiq, you'll not only get the answers, but you'll get a sheet that you can take with you to your physician so that you have the right questions to ask.
The webpage for the quiz, again, is mdvip.com/heartattackiq. You can find a link on our webpage, as well as information about all our guests at radiohealthjournal.net. You'll also find archives of our programs there, as well as on Apple Podcasts and Stitcher. Our studio producer is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Being lonely is equivalent to the health effects of smoking 15 cigarettes a day or consuming more than 6 alcoholic drinks daily.
Loneliness, an epidemic in the elderly, and it's creeping into younger generations as well.
Then, trypophobia, the fear of clustered holes.
I do refer to it as the most common phobia you've never heard of.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.